Hi, my name is Gabby and I'm with Heritage Sierra Medical Group. I'm so excited today to introduce you to one of my colleagues, Jason Vallejos. Now, before we begin, I'm excited to reveal that Heritage Sierra Medical Group is a primary and specialty care network of doctors with over 450 servicing the Santa Clarita and Antelope Valley. Now, here with me now is Jason Vallejos. Jason Vallejos is with Syndicated Insurance Agency and is a licensed agent with over 20 years of experience working with Medicare plans. Today, Jason will be speaking to you about Medicare options that may be available to you. Welcome, Jason. How are you?
Thank you for having me here, Gabby. It's such a pleasure working with Heritage Sierra Medical Group, and I'm so glad to inform the audience about important information regarding Medicare and how to access care and all the different A's through D's about Medicare.
Absolutely. Now, for those of you tuning in at home, I highly recommend that you take out a pen and paper and take notes because Jason is going to walk you by the A, B's, C's, and D's of Medicare.
Basically, someone who qualifies for Medicare are folks that are typically over 65 and have contributed towards Social Security for over at least 10 years, or people with disabilities. They don't have to be 65 or older. They can also be disabled and have qualified for disability benefits, and they can receive Medicare that way. And so folks that have contributed through Social Security, let's say a wife or a husband didn't work enough, they can also receive benefits through the years that their spouse worked. So let's say you didn't contribute 10 years, but maybe your spouse did. Those years that your spouse contributed towards Social Security also count towards Medicare allowance. There's 4 parts to Medicare. Part A is the hospital coverage. Part B has the medical coverage, your specialist, your primary care physician. Part C, which is what we're going to be focusing on today, is a Medicare Advantage plan and HMO coverage that combines all the benefits plus more. And then Part D, which is also included in Part C that we're going to be talking about today in the plans that Heritage Sierra Medical Group works with, which covers your prescription drug program.
Fascinating. Now, are there things that Medicare doesn't cover?
Good thing you asked, Gabby. So Medicare alone doesn't cover what's called a deductible or the co-insurance or co-payments. Your outpatient prescription drug program is not covered through standard Medicare. Healthcare for outside travel, if you leave the United States, hearing aids and hearing exams, routine eye exams, and most eyeglasses are not covered through Medicare.
Hi, so we covered Part A through C. Tell me a little bit more about Part D.
So Part D is a necessary coverage for you to be able to get prescription drugs. Whenever you get a prescription from your physician, you need that coverage. And that is a part outside of Medicare, is privatized, and you get to select it. For those folks that have income issues or income limitations, there is assistance through Social Security and the Department of Healthcare Services that can assist you with assistance on the Part D portion.
Well, how do you qualify for a Medicare Advantage plan? And all the time I hear about seniors who come in and get coverage for their eyeglasses, their hearing aids, dental coverage. So tell me a little bit more about that.
Good question, Gabby. So to qualify for a Medicare Advantage plan, you have to have Part A and Part B of Medicare. With the plans we work with, do not have an end-stage renal disease diagnosis. Other than that, you're guaranteed issued to be accepted for a Medicare Advantage plan. By accepting a Medicare Advantage plan that works with Heritage Sierra Medical Group, you may receive some additional benefits that include dental, vision, transportation to and from the doctor's office, worldwide coverage anywhere outside of the United States and anywhere in the United States in the event of an emergency, your vitamin coverage, even a gym membership. So there's a lot of different benefits that you may qualify for through a Medicare Advantage plan.
I know that there's a specific time that you can apply for these plans. Tell me a little bit more about the enrollment periods.
Yes, standard beneficiaries for Medicare Advantage plans have to apply between October 15th and December 7th. However, there are certain ways to enter into a Medicare Advantage plan even if you miss that window. One is if you also have Medicaid or Medi-Cal, that gives you an opportunity to be able to apply, or with some of the plans we work with, Heritage Sierra Medical Group, a chronic condition like high blood pressure, heart disease, or diabetes.
I know that Part C represents the medical group, and we're a medical group as Heritage Sierra Medical Group, but tell me a little bit more. How do these star ratings work?
Yeah, so star ratings are really important. It's the way that CMS, the Center for Medicare and Medi-Cal Services, rates a Medicare Advantage plan. The higher the star rating between 1 to 5, the better the quality of care, the customer experience, the delivery of their services. and the overall experience to the customer. So when you're considering a Medicare Advantage plan, do consider the star rating of that plan. Again, between 1 to 5, the higher the star rating, the better quality of care you'll experience.
And now more than ever, it's more important that you're connected with your doctor. And I'm very thrilled to introduce to you one of our most beloved providers, Dr. Parvinci.
Hello, my name is Dr. Amir Parvinci. I'm an internal medicine trained physician in the network with Heritage Sierra Medical Group. And I wanted to talk about some of the best practices for the office. For healthcare, it's focused on prevention, treatment, and information. However, the one clinical thing that most people are forgetting these days is accessibility to the office and their provider. Current conditions require we take a step back and review the quality and access to care we can provide while remaining compliant and safe with all the guidelines. Ask yourself, is your primary care practicing staying open through COVID-19? Are they offering telemedicine visit options? Where can you virtually connect with your provider? Can you get in touch with your provider? Has your provider contacted you during these difficult times? I am proud to say that I stand by Heritage Sierra Medical Group's motto. We treat our patients like family. I, like the other providers, have checked on my patients and reviewed their care plans. I have filled and ordered new medications for them, and when appropriate, offered telemedicine visits or in-person safe space in our clinic for visit options. During these challenging times, please confirm the quality and access to care you are experiencing with your medical provider. And know that I and other providers at Heritage Sierra Medical Group are here for you. Stay safe and healthy, and thank you.
Thank you so much, Dr. Parvinci. We really do appreciate your time with us today. And I just want to say thank you once again to Jason for his presentation and all the information he included about Medicare. We really do appreciate you. And if you have any questions relating to your situation, Medicare, coverage, etc., please don't hesitate to call us. We're here to help and assist. Something that you may not know is that Jason is an independent agent, so he can compare plans to ensure that you have the right plan selected for your needs and coverage.
Thank you for pointing that out, Gabby. And again, we're an agency that's been established for many, many years. You can reach us online at www.syndicatedins.com, or you can call the number on the screen, and one of my representatives will be happy to answer your questions. Sometimes you'll meet with me, or sometimes you'll meet with one of the many representatives that are very well versed on everything that has to do with Medicare.
Thank you so much, Jason, for joining us. We're so excited to learn all this information about Medicare. We truly appreciate it. And for our listeners at home, please stay safe. We really appreciate you tuning in. Until next time.